Thank you, Premier. Good morning. 1,438 new cases is a very challenging day for Victoria and a very challenging day for this particular outbreak. The surge, this event, the 50% increase in these numbers is down to a significant number of social gatherings over Friday and Saturday of last weekend. So we've seen over the last few weeks, of course, ongoing transmission within households, ongoing transmission between households, usually between close relations. What is different about the numbers today is that the activity 5 or 6 days ago, Friday, Saturday last week in particular, was quite different. The contact tracers tell us that there have been significant numbers of social gatherings on Friday and Saturday over a long weekend. Grand Final parties, other social gatherings, barbecues, backyard visits. And all of this has generated significant additional caseload. So around a third of our cases today, we think are due directly to those different types of social gatherings, as people have dropped their guard and decide that it's a grand final weekend, it's a long weekend, we deserve a bit of a payback, we deserve a nicer time. And that has now translated into at least 500 additional cases from what we would have expected to see today. And we can see it not only in the contact tracing interviews, we see it in our mobility data, in our traffic data. We have had the busiest mobility, the most activity on our roads over the 3-day weekend of any lockdown weekend since the end of July. We're seeing a shift in the age profile. So in today's cases, 55% are men. It's quite a different profile to what we've seen for the rest of the outbreak. We're seeing a disproportionate increase in those aged between 20 and 29 and those aged between 20 and 50. So over 55, 56% of the cases today are in their 20s, 30s and 40s. Again, disproportionately high to where we've been before. And probably most notably, 6 out of 10 of the cases today are from new households. So we've seen a significant sparking off of new households, with the transmission jumping from known communities and known households into new, fresh territory. We can also see it in the sharp increase in cases in the southeast and eastern suburbs. So unlike previous days and weeks where we've been reporting a very static picture, now around a quarter of all of today's cases, 329 of them, are in the east and southeastern suburbs. And the map is far more diverse than before. We have a far greater scattering into new suburbs, new communities, new households that haven't been touched by coronavirus before in this or any of our other recent outbreaks. So we know that everyone's fatigued. We know everyone's tired of this, but today is a significant setback in how we manage this outbreak. It's a significant setback on our Burnett roadmap, and it's moved us, if this trend is contained, and of course we'll see that in the coming days. Today may just be one big rogue day that we all grip up together and drive back down. But if this trend is continued, and if we see similar case numbers over the coming days, then we'll go from being just below the mean on the Burnett projection. So we were tracking favourably over the last 10 days. We will jump to the worst quartile of those Burnett projections. Too early to conclude that now, and of course that's the work of our epidemiologists. But if that trend is contained, if we're seeing continued spread of these kind of cases over the days ahead, it'll have very grave implications for our nurses, for our ambulance workers, for our hospitals, and for people who need care, whether they need care for coronavirus, or whether they need care for other purposes. This outbreak still remains within our hands. We still have so much left to play for, and I think today highlights the consequence of hundreds of people dropping their guard for very understandable reasons. We're all fed up with it. But this is a direct consequence of hundreds of decisions made on Friday and Saturday of last week. And the question now is how we manage this going forward. In terms of the landscape that we have today, so of the 1,400 or so positive cases, a third of those individuals were vaccinated with at least one dose, 7% were fully vaccinated. So again, we're seeing a disproportionate infectivity rate amongst the unvaccinated, with now less than 1 in 5 adults not being vaccinated, a significant skew towards the unvaccinated being far more vulnerable to the infection. We have, as I said, a quarter of the cases in the southeastern suburbs and the eastern suburbs. We have 2,661 cases in the west. We have 6,401 cases in the north. A significant drop in the proportion of cases in our northern suburbs, the areas we've been working on so closely over so many weeks. In terms of regional Victoria, we have 46 cases today in regional Victoria. I'll pick out the ones that are of probably most significance. 2 additional cases in Latrobe, and can I just thank the communities of Traralgon, Morwell, Moe and Warrigal for coming out in numbers over the last few days to get tested. over 660 tests yesterday, just across Morwell, Traralgon, and Warragul. A really strong performance. A lot of additional testing resources put down there, and some very busy queues. And my thanks to everybody for doing such a great job in turning that round. Only 2 new cases identified so far, both known primary close contacts. So that's an encouraging first day